How to get rid of a yeast infection fast. Yeast infection happens to be one of the most common forms of fungal infections. The genital area is where it usually targets, thereby bring about discharge, itching, and pains. But what are the ways through which yeast infection can be treated at home? Genital yeast infection seems to affect women more than men. 75% of women experience a minimum of one infection throughout their lives. A yeast known as Candida albicans has been discovered to be the most common cause of such infections. There are other forms of yeasts which are responsible too, though. There are different types of treatments for yeast infections. These include home remedies which are self-administered. The major aim of this post is to discuss 8 methods through which yeast infection can be treated in the home. It is all about finding the one that works perfectly for you. Home remedies. It is very possible to treat yeast infections at home easily and successfully. This can be done either through some therapies or over-the-counter products. Anecdotal reports have suggested that most women have experienced relief through these methods. However, it should be noted that the effectiveness of these therapies vary. Over-the-counter treatments. Antifungal treatments using pessaries or creams can be bought over the counter for the treatment of yeast infection. These can be gotten and used without any prescription. They can be either bought online or via other outlets such as grocery store, drugstores, and pharmacies. Depending on the nature of the product, usage can be internal or external. Also, it can involve days of application such as single application, 3 days application or a week-long application. Treatments applied internally are responsible for the curing of over 80% of cases related to yeast infection. They contain extremely powerful antifungals known as azoles. Boric acid. Women suffering from yeast infections can use vaginal boric acid capsules. They can be very helpful for cases which have to do with recurrent infections. According to CDC, Centers for Disease Control and Prevention, 600 mg dosage of boric acid in capsule form is inserted vaginally once every 14 days. Prior to buying any suppositories, it is important to seek the professional advice of a doctor. There are studies which have suggested that when boric acid is applied alongside the antifungal flucytosine, about 70% of women have been treated successfully. This study tries to look at women that didn't respond positively to antifungal treatments which are azole-based. Tea tree oil. The antifungal properties of tea tree oil make it very important. There are women that have relief when using diluted tea tree oil. It gets added to a tampon, after which it will be inserted into the vagina and left to stay there overnight. It has been advised that extreme caution be exercised when using tea tree oil since it can bring about skin irritation. Also, vagina walls have been discovered to be very sensitive. Tea tree happens to be an essential oil and as such, it has to be mixed together with carrier oil. It is possible to make use of 1 ounce of coconut oil warm and mixed with about 3 to 5 tea tree oil drops. Get them soaked in a tampon. Don't forget to regularly change the tampon. Also, there are people who may be allergic to this essential oil. It is important that the diluted oil is tested on the forearm before deciding to apply it on the genital areas. Once there is no reaction after observing it for about 12 to 24 hours, it can then be applied on such sensitive areas. According to other studies, tea tree oil's component can improve antifungal drug fluconazole's activities, such as in the case of Candida albicans, which are drug-resistant. Probiotic supplements. There are probiotic supplements, which can offer natural treatment for yeast infection and fungal infection. They can be found in pharmacies, online and health stores. There are probiotic supplement brands which sell formulated products, which are meant to enhance female reproductive health. Their aim is to ensure that there is restoration of bacteria and yeast balance in the vagina area. They are either taken internally or orally. A study which was carried out in 2012 showed that women suffering from chronic yeast infection had a probiotic pill inserted into their vaginas. About 87% of these people experienced improvement in symptoms. Such treatment also had an effect that is long-term on the yeast, which is the primary cause of the infection. Women in the study made use of one pill in 7 days. One was inserted every third night for about 3 weeks. The treatment was used once a week as a way to prevent the infection from surfacing again. According to other studies, probiotic lactobacilli will increase antifungal medications' effectiveness being taken by women suffering from vaginal yeast infection. Natural yogurt. Beneficial bacteria can be found in non-flavored, natural and unsweetened yogurt. A study was carried out in various forms of probiotics, and it was revealed that they may fight certain yeasts which can lead to vagina yeast infection. Although lots of issues were flagged when these studies were reviewed, many people reported relief from eating yogurt, inserting it vaginally, and getting it applied to the vulva around the vagina. Coconut oil. Coconut oil contains antifungal properties. That is why it has been discovered to be very effective when it comes to fighting against Candida albicans yeast. Coconut organic oil raw can be applied either internally or externally in order to ensure that the symptoms are eased. It is also possible to make use of warmed coconut oil as carrier oil. This becomes necessary for those antifungal essential oils that are more powerful. Coconut oil can be bought online. There are products which can be used for cooking instead of being applied on the skin. This is why you have to compare brands and products in order to know the one that is ideal for you. Garlic. Garlic isn't only antifungal but also antibiotic. Studies have shown that garlic consumption can affect levels of yeast inside the vagina. There are women who have used garlic internally as an alternative towards eating it. They have claimed that it has provided some relief from yeast infection. A garlic clove is placed into the vagina overnight threaded with string. Although there is no evidence to prove whether this method works, the risk isn't high. People who have sensitive skin can experience skin burn as well as skin damage. Due to this, those who have sensitive skin shouldn't make use of garlic. In case burning sensation continues to get worse, its use should be discontinued. A vaginal cream which contains thyme and garlic can be very effective when it comes to treating yeast infection. Oil of oregano. Originum marjoram is the form that most oregano usually takes, and it doesn't have any special or unique properties. It is a perfect solution for fungal infection. However, the oil of oregano, which has its origin from Originum vulgar, wild oregano, contains 2 antifungals that are potent: carvacrol and thymol. According to studies, Candida albicans can be stopped or inhibited once wild oregano oil is used. Capsules which contain this oil can be inserted into the vagina during the night period. Another way is getting it applied to a tampon prior to insertion. It is recommended that different products are compared. Essential oils shouldn't be applied directly to the skin as they need to be mixed with carrier oil. You can get about 3 to 5 drops of oregano oil mixed with 1 ounce of almond oil. You can also use olive or coconut oil. Soak a tampon inside the mixture for few minutes, after which you can insert. It should be changed every 2 to 4 hours. A medicated tampon shouldn't be left for over 6 hours. In order to test for allergies, apply oregano oil on your forearm before using directly. When home remedies should be avoided. Most of the home remedies are safe for application. However, people who are mentioned below should avoid applying them. Those experiencing recurrent yeast infection, people who have contracted STD, sexually transmitted diseases. Pregnant women. Those who are not sure about the cause of their symptoms. Prevention. The following precautions can be taken to prevent vaginal yeast infections. Putting on cotton underwear and loose-fitting clothing. This can help avoid any form of fungal infection. Tight jeans as well as pantyhose should be avoided. Wet swimwears should be changed as quickly as possible. Vagina sprays, lotions, perfumes should be avoided. These can cause irritation around the vagina, thereby bring about bacteria and yeast imbalance. Properly dyeing the genital area after bathing of showering, avoidance of douches. Using lubricant that is water-based during sexual intercourse. Showering after oral sex or intercourse. Eating foods that are rich in probiotics. Reducing sugar intake as yeast has been discovered to survive on sugar. Taking antibiotics whenever necessary. These can unstable the balance between yeast and bacteria in the body. Choice of contraception can also influence yeast infection. For instance, yeast growth can be promoted by contraception which is estrogen-based. Symptoms. Yeast infection has the following symptoms. Burning, pain or itching around or in the vagina, vaginal burning during urination, painful intercourse, skin sores or fissures, vaginal discharge that is thick and white, redness, rash, swelling. In the case of men, fungal infection symptoms at the penis head will be noticed such as irritation, discharge, itching, redness. Seeing a doctor. Although home remedies can help to treat yeast infection, it should be noted that they aren't that effective in every case. People should consult their doctors when they're pregnant, such as the first time they are experiencing yeast infection. The infection is severe. The infection is recurrent, thereby showing up about 4 times in 12 months. Symptoms fail to improve after using the home remedies. Patient is experiencing some medical conditions such as diabetes or the immune system has been compromised.